I got to tell you, I am just so thrilled by what we've got going here. You Medvaleese has been saying, feel pretty comfortable with knowing the people that are in my club, but there are so many smart people out there in the rest of Medvale. How do I get to know them? And so we've been paying attention and saying, let's come up with some ideas to do that. So, for example, a bunch of us here on the picture are going to Ohio to do a group hug here pretty soon in 2 weeks. Then, of course, we've got the block party coming up in Denver in November. But in the meantime, we're going to do these on the second Tuesdays of every month. And we have really a good lineup of speakers. There's folks out there that want to get in front of this august body. And so we're booked up for the rest of the year with speakers, great speakers that you're going to hear some more about, but none greater than Ted. So we're going to start talking about Ted here pretty soon. And I can't think of a better way to kick off this speakers series than have our own TED talk. And so just a little bit of backdrop there is that, but boy, Ted has been such an important thought partner to me. We've been on each other's boards. He was certainly a big part of me selling my practice management company, MedMan, back then, and then helped me to think about what my 3.0, what the rest of my life might look like. So, Ted, you've been a Medvaleista longer than anybody else on my screen, actually, before we knew what a Medvaleista was, before we knew what to name our little town. So his fingerprints are all over what we do. And I am so appreciative of Ted for being a mentor, a thought partner, and has become a good friend. He taught me to fly fish. He tried to teach me to golf. He's been a very important part of what we do, is the point here. And so, Ted, you're in our Sages Club. You've been a dolphin in 4 of our dolphin tanks, for example, and your testimonials on our website. So again, thank you, Ted, and glad that you have accepted my request to be our kickoff speaker. So it's going to be 45 minutes. It's going to go very fast. And Ted suggested that maybe in the first 20 minutes or so, we get through his presentation, and then we open it up to having more of a Medvale sort of a discussion about this questions and answers. So we're going to do this. Tiago is recording this, so this will be available to you and your friends to tap into later on. So, Ted, welcome. Would you just start off by helping your Medvaleista friends here know you a little bit better, your journey from wherever you started to being a very influential physician leader?
Well, thank you, Jim. Good morning to my fellow Medvale citizens. It's good to be with you and to meet many of you. And I think we're all connected by the mayor of Medvale, our own Jim Trounson. You know, I think in a post-pandemic world, there's a need for people to reach out and to start talking to each other again. And I think that's why Medvale has become a successful model, is that we all need that interaction from each other and to learn from each other. So a little bit about me. I'm born and raised here in Idaho, up in the Pacific Northwestern part of our country, and was the oldest of 5 kids. When I was 15, my youngest sister died. And my father called me from Salt Lake City, Utah, where she was having open heart surgery for a medical problem she had, and told me that my sister had died and to let my brother and sisters know. And on the spot, I told my dad that I wanted to become a doctor. I had never given that thought prior to that phone call. And it was one of those moments, life defining for me in my life. Her life stopped, mine started on this track of being a physician. And it was all because I wanted to do something to help people like my sister. So I was very driven from adolescence into medicine. Went to medical school at the University of Washington, at which point my father had a second important conversation with me. And he said, Ted, so how are we going to pay for this? And I said, gee, Dad, don't worry about it. He owned a single cash register grocery store. And I said, I'll figure out something. And the military was offering scholarships if you got a military scholarship, they would pay your way through medical school and give you $400 a month, which back in 1976 was a huge amount of money. And my wife and I were extremely appreciative of that. So I took a scholarship with a 4-year payback, and the Army just kept giving me more and more opportunities, and all of a sudden became a 21-year career in the U.S. Army as a family doctor. I retired in 2001 as a colonel, and in that time period had served in the Gulf War. I was the head trauma doc at a MASH hospital. I got to be involved with taking care of 2 presidents of the United States. During my time, I was a hospital commander. I led graduate medical education programs, had a marvelous 21-year career, and then retired in 2001, came back to my home state of Idaho, and was the CEO and president of our health system here, which has about 430 employees, $56 million a year system. We have 5 graduate medical education programs scattered throughout southwestern Idaho. And during that time, I was elected to be the president of the American Academy of Family Physicians, which is a 150,000 member organization across the US. And during the time, which was 2007 to 2010, that I was the president-elect, and chairman of the board of our organization, I got to work very closely with President Obama and Congress to develop the Affordable Care Act. I had 6 trips to Washington, D.C., in which I talked with President Obama and his administration, and 21 times I testified to Congress in those 3 years, and helped develop at that time, which was believed to be a very important bill, it still is, and law, to help transform healthcare in this country. So that's a bit about me and my journey. I'm passionate about trying to have a better health system in this country. I was also on our public health department board for 15 years as the only physician member of the largest health board in the state of Idaho. And so both of those experiences of being at ground zero of helping with healthcare reform and being at ground zero of the pandemic through the public health department is what led me to write 2 books. The first on our health system was entitled Fractured: America's Broken Healthcare System and What We Must Do to Heal It. And the second was Preparing for the Next Global Outbreak, a guide to planning from the schoolhouse to the White House. And both of the reasons I wrote it, and I'll stop with this, were because I was deeply frustrated by what I saw not happening in the United States to develop a better healthcare system, and what I saw not happen in the United States to do a better job with handling the pandemic. And Jim, I'll stop with that at this point, and I know you've got some other questions for me that you would like to ask.
Yeah, well, Ted, we have a number of physician leaders and entrepreneurs here. And you know, you're the busiest physician executive that I know. I think we all have a book inside of us somewhere but we just never get around to sitting down and writing that. How did you do that?
Yeah, it's a great question, Jim. Again, as you guys can tell a little bit from getting to know me a little bit, I'm a pretty driven guy. I got driven into healthcare with the death of my sister. I got driven by these two incredible life-changing events, the creation of the Affordable Care Act and the pandemic. And one of the ways that helps me process hugely morally distressing issues is to write. I've always done that, and keep a daily journal. I have since college, and putting things on paper is helpful to me. So it became kind of a cathartic exercise for me just to write about it. And so I just spent weekends and nights putting thought on paper. And the big part of that was just getting it on paper. I think you're exactly right, Jim. All of us have books in us. All of us have things we want to teach. The big issue, I think, that keeps most of us back from that is not putting thought on paper and getting going. It doesn't have to be perfect. We get paralyzed, I think, by it's got to be perfect. One of the breakthroughs in my own thinking was just get it on paper, Ted. Once it's on paper, you can start to work with it. You can start to edit it. You can have others look at it and give you thoughts and feedback. So, Jim, it was almost a catharsis and a relaxation technique for me to write. It helped deal with my moral distress. It helped me relax, and both of those efforts resulted in books.
Well, it's certainly helping all of us. I've read both your books. I promote your books. I learned so much from your books. So, thanks for getting it out of your head and into my head. And Ted, when I was on your board, I was so appreciative of the first 20 minutes of every board meeting. You would tell us what's going on with the pandemic from your front row seat. And what an exciting place for us to be. And so very helpful is to hear from you what the science was. So let's talk about your book. And Tiago, why don't you flash it up? Ted, you're going to be at our Ohio meeting in a couple of weeks, and then you're going to be at our Denver block party too. And you can personalize and sign everybody's book at that point. But what drove this book, and what kind of things are you and Dr. Pate imagining as you thought through this? Why did you write it? What would you hope that would come out of this? And then eventually tell us what Medvaleistas can do to prepare for the next global outbreak. And I'm so fascinated because you talk, a quote in the beginning of the book was, "Those who cannot remember the past are condemned to repeat it." And so this may save us some consternation later on. And so anyway, tell us about maybe some of the key points of this book, Ted.
Okay, Jim, if we could just take the book down now, Tiago, so I can just talk to my fellow Medvale folks. Not only are we condemned to repeat it by not learning, but we're condemned to repeat it if we don't teach it. And that's another important point, is that we wanted to put in writing then something that could be used downstream by people, groups of people, to learn from this. When the pandemic, the SARS coronavirus 2 pandemic started to spread, both David Pate, my co-author with this, David is a retired internal medicine physician who was the president and CEO of our largest healthcare system in the state of Idaho, St. Luke's Health System, for those of you that might be familiar with David. we were both deeply frustrated, and we did literature searches. What's out there on the pandemic, and lo and behold, if there was very little written in regards to the learnings that could be applied to school boards, to public health departments, to communities, to businesses. It was almost like we were in a free fall. And you all remember those early days of lockdowns and confusion, the fog of war, if you will, that was on us all. And there was no good learning. And there was a total failure of leadership, the total failure of communication that was resulting from all of this. So that is why we opted to put this into writing, was to hopefully help future generations and others years from now have a source to go to learn from. Part of writing any book is getting it published. And Johns Hopkins University was absolutely fascinated with the book. And the reason they wasn't because of the current science of COVID. It was from the lessons learned that could be applied downstream. They saw what we saw in wanting to write the book, which was a primer on being a resource for federal governments, state governments, local governments, mayors, public health departments, school boards, fire departments, police chiefs, anybody that had a role, which we all had roles with this pandemic, be used as a resource downstream. And that's why they picked up the book. There are a couple key ahas in the book that I'd share with you all. First, and you know, I know it's not lost on you, but the U.S. represents 4% of the world's population, but we represented over 25% of the world's sickness, hospitalizations, and death from COVID. We were the poster child in the United States for what not to do. And there are a lot of things that we just totally screwed up. I'm going to start with just a couple of these. First, from a leadership perspective, we had a total failure of leadership. And again, I'm not trying to be political with any of these comments. I'm calling balls and strikes as I see them. But Donald Trump, quite frankly, became a comorbidity of COVID-19. We probably had in excess of 50% of our deaths and hospitalizations due to the fact that we as a nation had our heads so far up our butts in regards to response to the pandemic early that we got way behind the 8 ball. And in fact, actually became more polarized instead of coming together. Now, a good leader will bring people together and get the best out of the team to respond. That's not what happened in the United States. We fractured over the pandemic, and many of you saw and lived that. Doctors went from being heroes in the early part of this to villains by the time it was done. And all of that is really laid at the feet, not solely of presidents, but clearly Donald Trump had his fingerprints all over the failure of our response as a nation. And the same happened at state levels too, and states varied with this. One thing that the military always teaches is that you need a central strategy with decentralized execution. If that strategy had been applied to the pandemic, we would have had central control over the nation of how we responded with decentralized state to county to city execution of a plan. That's not what happened. What happened was that President Trump decentralized this to the states, and the states, on the most part, decentralized it to their public health districts. And the public health districts which most of you may or may not know, aren't made up of physicians that have any knowledge of public health. They're mostly made up of county commissioners and elected politicians who have a totally different agenda than public health. And we saw that play out in spades in Idaho. Initially, our governor of Idaho took the bull by the horns for the first month and executed a central strategy, but then started to get so much pressure and pushback by the citizenry that he punted. He ran for the hills and decentralized this to the county public health departments. And that's where this thing blew up, because their agenda wasn't the same as public health's agenda. Public health's agenda is to keep as many people safe as possible, to prevent sickness, to prevent death. What we saw was the opposite. It was done to protect economies, and it was done to protect people's perceived civil liberties. And so we got to be very narcissistic and self-centered about what this meant to me versus what it meant to us as a larger public. So the failure of leadership in this to get that right was one of the key ahas we write about, so that downstream people will understand the importance of good, consistent leadership to follow a central strategy with decentralized execution. One of the other big pieces here, and I'll just give you a couple more because I could talk a long time. The book weighs in at 375 pages with 117 recommendations in it. And in 45 minutes, there's no way that we'll even get close to that. But one of the other key themes is just a failure of communication. We, again, got to be really polarized. There was a lot of misinformation and disinformation. You all saw that. We've got to do a better job of having trusted leaders speak to this in ways in which there's humility applied and humbleness about, guys, we're all in this together. This is what we know at this point. This is going to evolve as we go. We'll keep you up to date, but we need your help. We need your support. We're all in this together. We didn't get that kind of communication. The CDC must do a better job in terms of being a source of truth across the nation, and to proactively combat misinformation and disinformation from occurring, so that on its webpage, it can be updated quickly with evidence-based scientific fact, so that all of us know what direction truth is. There was failure to plan and prepare. The United States had a federal pandemic response, but it hadn't been practiced. And I'll tell you, at a state level, it certainly wasn't practiced. There are emergency preparedness plans that public health departments have to have and hospitals have to have, but there were no tabletop experiences done with pandemics or with board of directors to prepare for this. And a team will only perform as well as it practices. If there's no practice, then it's free fall. And that's what we clearly saw. Two other quick themes that we saw was a tremendous health disparities and healthcare inequities revelation. We saw this with the Affordable Care Act too. People that were poor or of certain ethnic groups live sicker and die younger. They don't have timely access. This was played out in spades with the pandemic, where mortalities were 4 times higher in Black Americans, Hispanic Americans, and Native Americans than they were in white Americans. And we've got to do a better job across the nation. If our goal with health is to improve everybody's health, not just some people's health, then we've got to do a better job with this. And that is a common theme, I might add really quickly to the group, that connects my 2 books, is the social injustice of having disparate healthcare systems to different people. It causes me moral distress, hence the writing. And so if there's a theme there between these 2, it's that. The last thing I'll just quickly mention is it had a devastating impact on workforce. 63% of physicians and nurses report that they're burned out. I have 180 providers that work in our organization. We're combating a tremendous amount of burnout. 43% of physicians across the nation wish they'd not chosen medicine. Can you believe that? 43% of America's physicians wishing they had not gone into medicine. That is unconscionable. To have a reaction in society that is not only burned out our workforce, hollowed it out, but keeping potential good people from wishing they'd even done it in the first place. On the science side of this, just two things at the buzzer on this, and then Jim, I think we might be able to move into the question and answer phase of things, is that with today's society and the use of artificial intelligence, we can do a much more rapid job of early detecting where global outbreaks are going to occur. We can tell from news articles that start to appear across the world in the world's press around where outbreaks of illness are happening. Just imagine this. We immediately are on top of Wuhan because they have 21 undiagnosed illnesses with 7 deaths, a high mortality rate. And all of a sudden, AI isolates that spot. WHO sends in a investigation team, not waiting for a country to invite them in, which was the problem in China, but already has worked out relationships with the United Nations for the world's good to send in a hotspot team. That does ring isolation around Wuhan and shuts down a 15-mile radius. This whole pandemic could have been prevented with a reaction within 3 weeks to the local press with a ring isolation attempt around Wuhan. There's no reason that we can't apply technology and AI to these sorts of outbreaks in the future that immediately calls to question where they're happening and gets it under control. I just want to mention one other thing here, and that is we're going to see a lot more pandemics. This isn't a rare lightning strike occurrence. With climate change happening, constriction of people closer and closer in larger and larger populations that are mixing with animals. So we have a back and forth exchange of viral genomes between single-stranded RNA and DNA, double-stranded DNA viruses. We're going to see more and more both epidemics and pandemics emerge through this. We must get smarter in terms of early identification and learning to respond to this. This is a symptom of the planet's illness, if you will. If you'll allow me to use the metaphor of the planet as a patient. We're going to have more of these as we age as a planet and as the climate warms. And so we must learn from this, hence the importance of the book. And let me just leave you with one last thought, which was a bit of an aha for me. Pandemics don't only happen to humans, they happen to all animals and plants. There's more and more of this happening. We only know it from what it means to us as humans. But avian influenza is a perfect example of wiping out huge populations of birds. There are multiple ongoing illnesses, viral illnesses in other animals and plants. And we must be aware of this because we're all connected on this planet, not only as human beings, nation to nation, but across animal species and plant species that we depend on for survival. So it's all connected, it's all important. We must do a better job and we must learn from it. So Jim, let me stop with that. I think that gives folks a pretty good sense of what's in the book and what are some of the ahas. And Jim, I'll pivot back to you for other questions or just opening it up to the group for and love to interact.